The following segment is a paid commercial program by Heritage Bank, member FDIC. It's time for Ask the Expert on News Talk 1340 and 96.3 FM, KWLM.
And indeed, it is time for our Ask the Expert segment here this morning on News Talk 1340 and 96.3 FM, KWLM. And as you just heard, we are glad to be joined by representatives from Heritage Bank in studio with us today to talk about health savings accounts, and very apropos, of course, with those and open enrollment still going on. And who do we have with us here today, and what do you guys do at the bank?
Hi, good morning. My name is Mandy Fleming. I am the Minnesota Market Manager with Heritage Bank. I oversee the lobbies in our 4 Minnesota branches currently.
My name is Taylor Olson. I am the lead banking specialist. I am located out of Pennock. I assist with account openings and with trainings.
Good morning. My name is Erica Mejia, and I'm a banking specialist, and I open accounts. That's what I do there.
Okay. Well, we thank you all very much for being with us here today. And again, we're talking about health savings accounts here today. As we said, some very pertinent information here with enrollment going on. And I guess, basically the first logical question is, what exactly is a health savings account to those that might be unfamiliar with them?
Yeah, great question. So an HSA, or health savings account, is a tax advantage savings account. It lets you set aside some pre-tax money to pay for qualified medical expenses. At Heritage Bank, when you set it up, we give you a debit card that you can use to pay for those expenses as they come about. You can use it to pay doctor's bills or over-the-counter medications, prescriptions, things like that. It's a powerful long-term savings tool. So you can use the funds as they go into your account, or you can save them long term to use over time for unexpected high cost medical things. You can also use them to kind of cushion for retirement or future healthcare needs later in life.
Okay, and that kind of leads into our next question here. How exactly does a health savings account work to those that might be unfamiliar?
If you could think of an HSA as a special bank account for healthcare that comes with powerful tax perks, you would put money in or make a contribution. This is typically done via payroll or self-directed. The money would grow as it does accrue interest. You would be able to spend the funds on qualified medical expenses. And then if you don't spend the funds, you can keep the account. The funds do not expire, and you can always roll them over.
Okay. All right. And I guess who actually here, Erica, would be eligible to open and contribute to a health savings account?
So you are eligible to open an HSA if you have a high deductible health plan, and if you don't have any other coverage, and it isn't an HP, some exceptions like dental and vision exist. Once you're enrolled in Medicare, you can no longer contribute to an HSA, but you can spend existing funds. You're also able to open an HSA if you are not claimed as a dependent or someone else's tax return. Yourself or your employer or anyone else trusted to can make a contribution to your HSA.
Okay. And again, that kind of leads into our next question here. Mandy, what expenses will an HSA actually cover?
Yeah, I kind of touched on it earlier, but HSAs cover a wide range of approved medical expenses, like doctor's visits, prescriptions, dental and vision care, and some over-the-counter items. It typically doesn't cover your health insurance premiums, but preventative care, mental health services, and medical equipment are also some of the things that would be included.
Okay. And Taylor, I guess what would exactly make HSAs tax advantage?
There's 3 points that I would like to cover. The first one would be that there are tax-free contributions. The money that you put into your HSA is pre-taxed if done through payroll, or tax-deductible if you contribute directly. This lowers your taxable income for the year. There are tax-free growth. Any interest or investment earnings inside the HSA will grow without being taxed. And there are also tax-free withdrawals. When you spend HSA funds on IRS-approved medical expenses, you pay no taxes at all on those withdrawals.
Okay. And this is I think, really good question here. Erica, what do HSA funds actually expire? That's a good question.
Yeah, HSA funds do not have a deadline that they have to be used by. Any money you don't spend stays in your HSA and rolls over indefinitely. The account is always yours, even if you change jobs, healthcare plans, or retire.
Okay. And, also here, Mandy, what would be some contribution limits and deadlines for HSAs?
Good question, and it can be kind of confusing. So for a 2025 HSA, the contribution limits are $4,300 if you're single, and $8,550 for a family. For the 2026 HSA, limits are $4,400 for single, and $8,750 for a family. So they do change from year to year. If you are 55 or older, you can add an extra $1,000 as a catch-up contribution each year. So if you have contributed less than that, you can do an extra $1,000 to catch up.
Okay.
The deadline to contribute to is tax day on the following year. So that's where it gets a little confusing for some people. They think the end of the year is the last time they can contribute.
Exactly. Yeah.
So you have actually until April 15th of 2026 to contribute to your 2025 HSA.
Okay, so. Well, that's very good to know there, obviously. And, Taylor, I guess everything has its advantages and disadvantages. What are those for HSAs?
For some advantages would be the triple tax advantage that we talked about previously. Funds do roll over indefinitely. Portability, just meaning you can take it with you, whether you switch jobs or retire. Investment growth, there is interest that accrues on them. And family coverage, you can actually use your HSA funds for your spouse and dependents for qualified medical expenses, even if they're not on your high deductible health plan. The few disadvantages would be the eligibility limits, the upfront costs, which would be like the high deductible contribution caps, which we talked about would be the $4,300 or the $8,550.
Okay.
And penalties for misuse. For non-medical withdrawals before age 65, you would incur tax plus a 20% penalty.
Okay. And also, here, Erica, what are some things that people should be aware of before they maybe open up an HSA account?
So, first, you must be enrolled in an HSA-eligible HDHP. Cannot be claimed as a dependent. You have to be doing contribution limits. Qualified medical expenses covered medical, dental, vision, prescription, and some over-the-counter items. Does not cover cosmetic procedures, gym memberships, or most insurance premiums. Exceptions like COBRA, Medicare after 65, unemployment coverage, triple tax benefits, long-term considerations, and high upfront costs. Need to do record keeping. Keep receipts, and there are penalties for misusing funds.
Okay. All right. And also here, Mandy, I guess this is a really good question. What's the difference between an HSA and an FSA, which is a flexible savings account? It's a good question.
Yeah. Again, yes. So the HSA, the Healthy Savings Plan, you do have to have an HSA eligible high deductible health insurance plan. The HSA is owned by you, and it is portal, means you can take it with you if you change jobs. The flexible spending account is available with your employer's plan and is owned by the employer, and you cannot take that with you if you would leave that job. The HSA has contribution limits of $4,300 for the individual. Again, changes yearly, and $8,550 for a family. A flexible spending account is $3,200 for the individual. They do have both offer rollover from year to year, but the FSA is limited. And you can do some investing with your healthy savings account in mutual funds, things like that. And there's more detail on that. It would be best to, call, make an appointment, set up something with one of our banking specialists and come in, see what your options are. There's a lot of information out there. And if you're unsure, there's no silly questions or stupid questions. It's kind of why we're coming on here to make it known. We're always here to help and get you to come in and sit down with us and see what your options are, or just answer the questions for you. Yeah,
exactly. And Taylor, which that kind of leads into our next question here, or what is basically some of the process for setting up and managing an HSA account with Heritage Bank?
Well, with setting up an account at Heritage Bank, there's a few documents that we would need to collect, which would be a copy of of ID, social security number, email, phone number, and occupation. Once we get that information, we can go ahead with building the HSA and getting signatures. We would decide if the HSA would be self-directed investments or from an employer. There is a $30 opening fee that can be deferred up to 30 days. Once the account is open, we would love to assist you with making contributions and distributions. We can get you set up with our digital banking. You would be able to keep an eye on your balance and enroll in bill pay if that's an interest. And we do offer HSA debit cards to use for payments.
Okay. And, here again, just basically, I guess, finally here, kind of wrapping things up, some listeners might be unfamiliar. Where are you guys located here in Wilmer? Hours or phone numbers that they can call to stop, or if they have more questions, things like that, or?
Yeah, definitely. So the Wilmer branch is just off First Street, just before you go over the bridge. The number there is 320-235-5720, and that will get you to our customer care line, and they can help you either reach out to the Wilmer branch, Spicer, Pennock, or Raymond, and get you to one of our tellers or banking specialists to get an appointment set up and answer any questions that you might have.
Okay. And also, quickly, Mandy, you're just maybe kind of backtracking a little bit. It seems like these health savings accounts have really they've come into, lack of a better term, come into vogue here as of late. Have they been around for quite some time, actually? Or
Yes.
Yeah.
It has been a tool out there for a long time.
Okay.
A lot of employers have offered them, and I think it's just maybe one of the lesser known things, or people haven't looked into it.
Yeah, exactly. Well, I'll tell you what, thanks you all so much for being with us here today. Again, Mandy Fleming, Taylor Olson, and Erica Mejia all with us here from Heritage Bank, and a lot of great information about health savings accounts today. And as we just said, if you have any questions, again, stop in or give them a call, or better yet, check out your webpage too.
Yes, heritagebankna.com.
Yeah, a lot of great info there too. Thank you all for being with us here today.
Thank you.
Thank you.
Take care.